Right now at 5, a number that could save lives. A new mental health crisis hotline rolls out tomorrow. 988 will connect callers to a trained crisis worker who will listen, offer support, and offer mental health resources. Very important. Thanks for joining us here at 5 o'clock. I'm Jim Rosenfield.
And I'm Frances Wang. Those who helped develop the new simplified hotline believe it'll encourage more people to reach out when they need help. Now new at 5, NBC 10's Lauren Make joining us now. Lauren, what happens when people make this call?
Yeah, guys, in Philadelphia, for example, you will be routed to the Philadelphia crisis line. They want to get to you quickly. The average time it takes for them to pick up that call is 14 seconds. Then it depends on what your needs are to see what kind of assistance you may need or if you just need to talk things through. Well, the goal right now is to get this 988 number out so that everyone knows it before they need it.
988. 3 digits, easy to remember, but more than a number.
The country's Health and Human Services Secretary in Philadelphia today to announce the launch of a new suicide and crisis lifeline and a hope for what it can do.
When you hear 911, you think emergency and rescue. Starting tomorrow, when you hear 988, think crisis and rescue. If you're about to fall, reach out. We will catch you. That's what we want in 988.
The call line will route you to trained counselors, part of the federal government's effort to address mental health needs that have intensified.
We all know we've been through a very difficult 2-3 years, and it's affected everyone's mental health. And in some ways slightly, some ways very, very seriously.
In a roundtable today, Philadelphia Mayor Jim Kenney with some reflection on the need now and lessons learned from the past.
What we also learned in Philadelphia is, and sometimes the hard way, is that every response to a crisis is not 911. And we're putting a burden on our police because they're always not sure what they're coming upon.
The idea, law enforcement aren't always the answer for those in crisis.
But really, once we arrive on scene and connect with that individual, sometimes they just need someone to talk to. They don't need to necessarily go to the hospital. They just need someone to talk to until their next appointment.
The issue big enough to attract 2 cabinet secretaries, with the VA secretary noting,
"We are expanding our workforce by nearly 900 people so that we can manage the anticipated increase in calls at the Veteran Crisis Line on the 988 line."
And the federal communications chair whose staff worked to clear the 988 number just for this use.
It's a number they won't forget.
And a doctor new to the administration but well known to the community here, Dr. Ayla Stanford, explaining.
Will take time to transition, just like 911. But for these communities that we know and recognize are hurting, that is why we're here in Philadelphia, because it represents other cities across the United States.
Dr. Stanford, of course, now works in the Biden administration at HHS. And if you are looking for some help, you also have the option to text 988 to chat that way. The FCC chair today said they know that especially for young people, that might seem like a more natural way to communicate. So you have some options there in how to get help, but all using that 988 number.
Yeah, really easy to text.
Yeah,
All
absolutely.
Right. Lauren Make, thanks so much. And once again, that hotline number, 3 simple numbers, 988, starts tomorrow. To read more about how the Lifeline works and for additional mental health resources, just search 988 on NBC10.com or the free NBC 10 app.